Groin strain, causes and prevention. A groin strain is a muscle injury that can be painful and needs time to heal. We find out more about how groin strains can happen, their symptoms, and how long a person can expect recovery to take. Groin strain affects any one of a group of muscles at the top of the thigh. The muscle can be partially or completely torn, which can cause considerable pain and discomfort. For a serious strain, physical therapy may be needed, and a person is often given exercises to do. The return to a full range of movements should be done gradually. Intense physical activity may need to be avoided for weeks or months. Groin strain symptoms. The main symptoms of groin strain are pain and tenderness in the area. Other symptoms include bruising or swelling of the inner thigh, pain when a person raises their knee, pain when a person closes or opens their legs. The groin or inner thigh may feel warmer than usual. Muscles feel weak or tight. Limping or difficulty moving the leg. Pain can range from a dull ache to sharp pain. The pain will often be worse when walking or moving the leg. A person may also experience spasms in the inner thigh muscles. Groin strain grades. Muscles that move a part of the body, such as a leg or arm, are known as adductor muscles. Groin strain affects the adductor muscles in the inner thigh. A groin strain is usually a muscle tear from an awkward or sudden movement. It often affects people who play active and competitive physical sports. Groin strains are graded with numbers 1 to 3, depending on how serious the injury is. Grade 1 causes some pain and tenderness, but the stretch or muscle tear is minor. Grade 2 causes pain, tenderness, weakness, and sometimes bruising. Grade 3 is a severe tear of the muscle, causing bruising and a lot of pain. What are the main causes? Groin strain is usually caused by muscles in the groin being contracted or stretched with too much force. In practice, this often happens during sports where the leg is rotated or moved quickly upwards or sideways. Some examples of motions that could cause a groin strain include jumping, twisting the leg, forceful kicking, changing direction suddenly when running, lifting something heavy. It may also happen when muscles are being overused or are not warmed up. This is one of the reasons why it often affects athletes. Prevention. Groin strain is not always preventable, but there are some things that can help a person to avoid this type of injury. Warming up the muscles with stretches or light exercise before sport or physical activity can help avoid damage to the body. Keep to the same amount of exercise rather than taking part in intense activity now and then. Professional athletes usually train throughout the year to maintain their fitness. A person who does not exercise regularly or who is starting to exercise for the first time should go slowly. Pushing beyond what is comfortable or doing exercise that is too intense can cause injuries. Recovery. Grade 1 strains will take 1 to 2 weeks, of rest before a person can return to exercise. Normal movement, such as walking, should be possible within a few days. Grade 2 strains may take 3 to 6 weeks to heal fully. Grade 3 strains happen when most or all of the muscle is torn. The muscle can take 3 to 4 months to repair completely. A doctor or physical therapist will be able to advise on whether the muscle has fully healed. This is likely to be the case if a person can move their leg as normal, has regained full strength in their leg, is no longer feeling pain. Keeping leg muscles strong should help to prevent another groin strain in future. How is it diagnosed? Groin strain can be diagnosed by a doctor or a physical therapist. They will usually ask some questions to find out more about symptoms and how the injury was caused. A medical professional will need to know what activity a person was doing when they first felt the pain. They will also ask an individual if they heard a popping sound when the injury happened, noticed swelling after the injury, feel pain when moving their leg. The appointment will usually include a physical examination. This is likely to involve feeling the muscle and gently moving the leg. In some cases, more tests may be needed. This could include an X-ray or MRI scan to check that there is no other damage to the leg or pelvis.